to adolescents, from prenatal care to safe motherhood. We discuss it all: maternal health, vaccinations, infant nutrition, preventive care, mental, physical, and emotional wellness of both the mother and baby. We talk about what truly matters here. Tune in to Sunny 88.7 FM and also on Sunny TV every Friday morning from 9:30 a.m. to 10 a.m. Also, a repeat broadcast on Saturday morning from 9:30 as we bring to you the Cradle to Crayon show. Join me and my team of doctors and health experts as we answer your questions, give you expert advice, clear all myths, and also share real solutions. Remember that informed parents raise healthy children, and healthy children build a stronger future. See you. God Almighty, we are glad it's yet another Friday and welcome you to Cradle to Crayon show right here on Sunny 88.7 FM. We're live across the world on www.sunnygh.com. We say thank you to our sponsor, Back Specialist Hospital and Fertility Center. In the course of the show, open our phone lines, we get interactive. We are live on Facebook. Check out our Sunny 88.7 FM Facebook page, Cradle to Crayon Facebook, and also our Sunny TV Facebook page. Also live on Sunny TV, joining our discussion. Now, what happens when we realize that as parents, children have persistent bad breath even after brushing their teeth? There are times when they come home complaining their friends are making fun of them, and you've done everything possible. You can't seem to find a solution to it. This morning, I have here a dentist who want to discuss halitosis in children. I want to find out what this word means, what causes it, the treatment options available to parents, and then whether this can actually be prevented. But before they want to pick a break, a message from our sponsor, Rohi Children's Clinic, a time with Dr. Abna. She talks about diabetes in children. We'll be back.
Probably think diabetes is just for old men and women, right? Well, not exactly. Children can get diabetes too, but the type that they get is usually different from what the older people get. So what are the telltale signs of diabetes? The child may always be thirsty, or he might be eating a lot more than usual but be losing weight at the same time. Or the child might be passing large quantities of urine or be peeing more frequently than usual. If you notice any of these, take your child to the doctor fast. And please don't freak out. Diabetes is not a death sentence. Kids with diabetes can live healthy, happy life and live out their dreams. Early care makes all the difference.
Right here, brought to you by Back Specialist Hospital and Fertility Center. Now visit them for all your fertility, maternal and general health concerns. Their services include IVF, IU and other fertility services. They do child health and pediatrics, women's health and gynae, obstetrics and maternity, internal medicine, general OPD care, inpatient care, surgical service, that with general surgery and plastic surgery. There's theater service and also laboratory and ultrasound scan services. Locate them right here. They are in Accra, in Taifa. Call them on 0558 862 292 or 0592 196 003. Specialty Hospital and Fertility Center, integrity and excellence in health care. Our WhatsApp line is 0540 130 684. My guest this morning is Dr. Julius Amankwa Boaten, is a dentist from Trust Clinic in Dansoman. Dr. Julius, good morning. It's good to have you.
Yeah.
Yes. So, begin with, what exactly is halitosis?
Right. Good morning to your listeners. Halitosis is a very important condition causing a lot of discomfort and embarrassment for a lot of people. And it simply is persistent bad breath. Okay. So that is basically it. If a lot of people have bad breath from time to time, especially in the mornings, okay, after eating certain foods. But if it is persistent, despite
The time of the day.
the oral hygiene regimen, if it is persistent, then we describe that as halitosis.
Okay. For children, how common is this? Because usually we associate bad breath with adults. So when it comes to children, is this something that we have a lot of children seeing them with bad breath halitosis?
Yeah, so halitosis is quite common.
It's very
in
common.
many individuals. current estimates indicate that about 1 in 4 people, no matter the age, will struggle with persistent bad breath.
Okay.
So it's quite common in children. I see that a lot in children. A lot
Okay.
of parents bringing their kids in with a complaint that my son or my daughter has bad breath despite brushing.
Okay. How usually? What age does it start?
So there's no particular age that
Age
bad
that
breath
they
can start.
notice it.
Okay, so it can occur at any age, like I've already stated. And so from kids as young as 3 years old and above. And so it does not discriminate, basically. So it can affect anyone at any age.
Let's look at what causes this. So we are saying halitosis is the same as bad breath.
Yeah, persistent bad breath.
Persistent. So the persistent is a key
Yeah,
word
it's a
here.
very
Not
key
like
word.
once in a while you
Yeah.
have a bad breath
Yeah.
today and then okay.
yeah.
What causes this?
So there are the main causes of persistent bad breath can be found in the mouth. Okay, and so the main cause is main culprit in this case is bacteria. So you have bacteria accumulating on the teeth, on the gums, and especially the tongue. Okay, so if you are not cleaning your mouth thoroughly, especially the tongue, that's where a lot of the bacteria grow or accumulate. Then you can have persistent bad breath. Some other causes in the mouth are tooth decay. So you can have a cavity, a hole hiding somewhere where food can go and lodge in. If food stays there for a long while, it can ferment or go bad and then contribute to bad breath. And then we also have gum disease. So those account for about 80 to 90% of the cases that present with halitosis. And of course, there are other cases, those fall in the minority, those occur outside the mouth. So if you are someone who has persistent ear, nose, or throat infections, that can contribute to bad breath. Some of those infections, frequent colds, sinusitis, tonsillitis, those can contribute to bad breath. And then further down, if you have stomach issues, gastritis,
Stomach.
yes,
Okay,
those
can
can
travel
all,
all the way
yes,
up.
exactly. So they can travel all the way up to cause bad breath.
Okay. You kept mentioning persistent. So I know instances where people sometimes there's bad breath today. In a week or two, it comes back again. It goes and then it comes. That one is not it's not classified under halitosis.
It's not classified under halitosis.
Okay.
So, like I said, most people have or experience bad breath at some point. So, one common instance of bad breath is when you first wake up in the morning. You see, throughout the night when you are sleeping, saliva production is low. Your mouth becomes dry.
You've closed your mouth
You've
too.
closed your mouth for a very long period, 8 hours at least, and so that will present with some bad breath. But once you get up, you brush your teeth, saliva production starts, it goes away.
Okay.
Sometimes after certain meals, you eat food that has onions, garlic, or some pungent substance, and so that can cause bad breath. Or maybe during the day your mouth is dry, you're not talking, and so that can lead to bad breath. So maybe during the day, one tip, I can start giving the tips now, is to be taking sips of water to moisturize your mouth to prevent it from drying up and then causing bad breath. Or you can be chewing sugar-free gum to stimulate saliva production and then prevent bad breath.
Okay. 2 weeks ago, we discussed tonsillitis here. Apart from the oral issues that you mentioned, are there some medical conditions that can contribute to the halitosis? And
Yes.
the tonsillitis also
Yes.
added to it.
Yes. So in addition to, like I said, in addition to the tonsillitis, where the tonsils are inflamed, if there's pus, tonsillitis, the inflammation is or infection is usually due to the bacteria I've already highlighted, and so those can contribute to the bad breath. The frequent ear, nose, and throat infections can contribute to bad breath. The interesting thing is the mouth. Most people don't realize that the mouth is like a window into your entire body, or your
It's the
overall
opening.
is the opening.
Yeah,
Yes,
access to your body.
Yeah, and so sometimes the things that we find in the mouth or the things that come out from the mouth tell us something. I know we are talking about kids, but one thing I want to chip in is even in diabetics, there are certain states of diabetics where their breath has a certain smell or
Okay.
fruity smell.
Okay.
in a state called diabetic ketoacidosis. So they have that certain smell. So even if you are able to tell that, you know that, oh, this person might be having this condition. So the mouth tells us a lot. Okay, so that's why it's important to really pay attention to what is going on in our mouth, and then seek help when necessary. Halitosis basically tells us that there's something going wrong and that it needs to be addressed.
Okay. So what you said, it means that poor oral hygiene is a major contributing factor
Exactly.
to halitosis.
Exactly.
What
Exactly.
we are looking
Poor,
at.
poor oral hygiene is the main cause, or the main causes of halitosis are found in the mouth. So if you're not brushing regularly, you are supposed to be brushing at least twice a day, morning and in the evening. The evening brushing is, excuse me, the evening brushing is what a lot of people tend to struggle with.
Avoid.
They skip that, or they forget it, or they think it's not necessary. But the evening, they pay particular attention. I've realized that parents pay particular attention to the morning brushing.
The morning one.
Make
yeah.
sure they get their teeth to brush, their children to brush their teeth before they head off to school. But in the evenings, they are lax. Okay, so that can contribute to poor oral hygiene and halitosis. And then another thing people skip out on is flossing, using dental floss. Dental floss is a thread-like material that is used to clean in between the teeth.
And that's advisable for children.
For children, especially once the teeth start to touch. In children, we notice that when they have their baby teeth, there's spacing. Okay,
Yeah, there
so
are gaps
food in between their teeth, and so food does not easily get trapped in between. But especially when the permanent teeth start to come in, we see that those gaps close, and food can get trapped in between their teeth. And so if we do not get the floss in there to remove the food remnants, it can stay in there, ferment or go bad, and contribute to not only bad breath but to decay. And so flossing is also very important. If done at least once a day at night before brushing, that will go a long way to help. And then not just brushing twice a day and flossing, but brushing for at least 2 minutes. A lot of kids, they go in there, go and brush your teeth. They go in there 10 seconds, do something to represent
Maybe
something.
I think you'd have to show us the technique, because usually you brush, you do it, and then you're out of the place.
You're out of the place.
Yeah.
You should brush for at least 2 minutes.
2 minutes.
Yes.
It goes for adults as well.
Yes, for adults as well, for everyone. So you're brushing for at least 2 minutes, and then when you're done, you also pay particular attention to your tongue. The tongue is something people tend to forget or leave out.
It should be pink, ideally.
Exactly.
When it looks like most tongues, is white.
Yeah, white. If there's a whitish coating, that shows you that there's a lot of bacteria coating the tongue, and so it should be nice pink color. That's the sign of a healthy tongue, and that will also help to keep your breath fresh.
Okay. So basically, these are the things that
These are the tips
you can be able to.
So these, when you are doing this, I mean, you are reducing your chances of developing halitosis and any other dental issues. But if these are instituted, if you are doing these, but you notice that there's persistent bad breath, then it tells you that there's something else going wrong. And so it's at this point that you see an oral health professional, a dentist, to assess and then see if there are any hidden problems. The recommendation for children is that their first dental appointment should be done by their first birthday, or when the first tooth comes in.
Before we come to that, I wanted to find out about, ideally, these are the only symptom that will push you to come see a doctor.
Yes.
Is when there's a persistent bad breath.
Yes.
Means you've done all these and then it's still not
Yeah.
working. That is what should make parents
Yeah.
be concerned about.
Yeah,
Okay.
exactly.
Okay.
Exactly. And so once you've instituted all these measures, but it still persists, then you go in. But I was chipping in the recommended
Yes, you said
time
their first birthday.
by their first birthday.
Do we have a lot of parents coming in with their children?
Unfortunately, we don't have a habit of, preventive care or seeking out,
Yeah.
checkups and
Yeah.
all that. We
Yeah.
wait until there is an emergency.
Yeah.
Just yesterday, a 10-year-old boy came into my clinic. That was his first dental appointment, and
Yeah,
unfortunately, he had
10
pain.
years.
10 years. Okay, that's 10
Hardly
years.
would you see I'm going to see a dentist when there's nothing wrong
Unfortunately,
with you. Yeah.
unfortunately, a lot of dental problems, by the time they start to show symptoms, it means the problem is far advanced, and the treatment is usually difficult or expensive. And so I think it's smart to seek out checkups, preventive care early, so that we can catch things early when they are simple, when they are mild, easy treatment, and then we help you, partner with you, so that you're able to keep your teeth for your entire life.
Okay. Well, it's just 40 minutes at top of that. I have here Dr. Julius Amanko Boateng. He's a dentist with Trust Clinic. Dan someone we say thank you to our sponsor, Bar Specialist Hospital and Fertility Center. Visit their center for your fertility, maternal and general health concerns. Their services include IVF, IU and other fertility services. They do child health and pediatrics, women's health and gynae, obstetrics and maternity, internal medicine, general OPD care, inpatient care, surgical service, that's both general surgery and plastic surgery, there's theater service and also laboratory and ultrasound scan services, amongst others. Visit them right in Accra in Taifa. Call them on 0558 862 292 or 0592 196003. Basel Charles Hospital and Fertility Center, integrity in health care. Our phone lines have been open. Number to call is 0540 130 684 0540 130 684. It's the same WhatsApp line. Drop us a WhatsApp message. You can also put a message on our Facebook page. My doctor is here to answer you. So I know there are a lot of myths when it comes to halitosis. There are few ones that the ones that I've heard is when the children have the bad breath, giving them mint or whatever it is, it will just clear it. Does it work, or are there any other myths that parents have said that you want them to know that this is not true or this is true?
So we've already established that the main cause of halitosis is poor oral hygiene. And so if you're able to institute the recommendations, as the twice daily brushing for 2 minutes, the flossing, and then cleaning your tongue, and then having regular checkups and cleanings at the dental clinic, you shouldn't have any issues with halitosis. The herbal remedies that you just touched on, they may temporarily
Fail
mask or address the bad breath
the situation.
So, yeah, it will, if you chew the mint, it will give you a minty breath for a short period, but it's going to come back. The halitosis is going to come back. So the definitive solution is to have a check. If it is persistent, get a cleaning. What we do is usually do a cleaning to improve the oral hygiene, to reduce or remove the bacteria, the plaque in the mouth, and that will help improve the situation.
Okay, so usually when they come and you've diagnosed as halitosis, the cleaning alone. But is there some, can they tried all the options and never worked out? It means there's something different that you do.
Yeah, so the treatment actually depends on the main issue.
Okay, maybe the root cause or something.
Yes, so like you said, if they are not brushing well, okay, if they are not flossing, that means there will be a build-up of a lot of plaque in the mouth. So we can do the cleaning that will improve the oral hygiene. We can also educate them on a proper brushing technique, the duration, and then the type of brush to use, soft brush, which is what is recommended.
Soft brush.
Yes.
Okay.
And then a toothpaste that has fluoride. So once we institute that, then we monitor and review. If they come in and then we find decay, if they find a cavity, then we have to do, depending on how deep, whatever it is, we have to do a filling, or we have to fix the tooth, the decay. If there's gum disease, the cleaning that I mentioned earlier will address the gum disease. So these are the definitive solutions to halitosis. Another myth, while there may be some causes that come from outside the mouth, I've heard some things like there's a sore in the head or something like that.
It's true.
Yeah, so
it's true.
So
it's not true.
So no, there is nothing like that. The main causes are in the mouth. Okay, and then if there is indeed,
or maybe you are saying that there's a cavity, there's a decay, or maybe that's what they are saying, there's a co-team to cause the halitosis.
I do. We have this strange
of
description,
things,
explaining things, but the main causes are what I've already mentioned. And if there are indeed other causes of the bad breath, then we will make the recommendation to see the appropriate medical specialist to address those.
Okay. You made mention of gum disease.
Yes.
What usually causes that?
So I'm sure if we were to have a very lengthy conversation about the problems that affect our teeth and our mouth, we'll come to find that or realize that majority of them are caused by poor oral hygiene.
Okay.
So it comes back to the same issue, poor oral hygiene. So if there's a lot of plaque, it can cause an infection of the gums. So sometimes what people may notice is they are brushing. When they spit out, they see streaks of blood.
Blood,
Okay.
yeah.
Well, I mean, if you are,
Is it okay when it's once in a while?
if it's once, it could be that you are brushing too aggressively, or your brush is too hard, and so you are
yeah.
injuring the gums. But if it's regular, if it's occurring frequently, that should point
Okay.
to you that no, there is actually a problem going on, and I need to see my dentist to address it.
Okay. So I have some few questions here from Facebook. One from Chichi Bote Ado. She's saying that following closely than someone TTH repping. And then Eugenia Yale Annan says she's also watching live from DC. And then Chichi Bote Ado also said, Doc, please, is it advisable for kids to gargle with mouthwash? Yeah, mouthwash.
Yeah, so that's a question I get frequently.
Mouthwash. Yeah.
Mouthwashes are not an essential part of one's oral hygiene care kit. Okay, so if you are brushing, flossing, doing all the things that are recommended, there is no need. It's not recommended. In an instance where maybe you're away from home, you don't have your toothbrush or your toothpaste with you at an event, you've had some kebab or something, and then you notice that there's an odor, and then you have a mouthwash on hand, you can use that to rinse just temporarily to get the smell out, and then when you get home, you do the necessary. Or maybe you can chew on sugar-free chewing gum, etc., or rinse your mouth with water. By a mouthwash, they are mainly cosmetic, just temporarily mask the smell, but they are not the definite treatment for bad breath.
Okay.
And for children, I honestly wouldn't.
You would not recommend it for them.
Especially for the very young ones, they may swallow or ingest, and we don't want that.
Okay, because I didn't need to spit it out.
Yes, you need to spit it out.
Okay. The dental checks, how often are you looking at it?
So we are recommending that people come in to check twice a year.
Twice a year?
Twice a year.
Whoa.
It's not much. 365
So there's
days.
something wrong or not?
Yes.
Just come in and check.
So it's just a quick, if there's nothing, just quick. We do a cleaning and then you are off. Okay. And doing that, I think it's very smart. It's cost effective, because if you wait until there is an issue, then you have to think about paying for treatment which might be lengthy. You have to take time off school.
Yeah.
Because yesterday, the case I mentioned yesterday, the child who came in, he missed the day of school.
To miss school, yeah.
Yeah. So we don't want that.
And I'm sure there's a treatment. You need to take another day off.
You have to take another day off to come in. And so, and then you, the parents, you have to take time off work to bring the child.
Yeah. But the Ghanaians in us, sometimes you want to wait till you have to extract the tooth or something before we bring them in.
Unfortunately. But it doesn't have to be so.
Okay.
It doesn't have to be so at all. Just these preventive, these simple tips will make sure that you don't have any of these issues for the rest of the child's life. And putting in these habits now will save them a lot of trouble in the future.
You know, when I shared the flyer, someone actually asked me that usually with the halitosis, it looks like the few people who have it know, is it that, are they aware they have it? Because you meet people and like, this is what that is a bad breath, and are they aware? Are they on treatment which is not working, or what actually is the situation?
So a lot of the times we are able to adapt to.
You get used to it.
You get used to it.
So you don't smell it yourself.
Yeah, they themselves may not notice.
Okay.
That's most often the case.
Okay.
And it's a very sensitive issue. Just yesterday,
it is.
Somebody came to approach me and said, "No, I have a friend.
Okay.
And I've noticed this bad breath, and I'm trying to figure out how to
do I go about it."
I said, you know what? You can tell him, somebody, you can arrange for him if you are willing to come and see me.
Okay.
And then we'll give them a person a call and said somebody has arranged a surprise package, care package, something like that. So they can come in and then we'll sort them out.
Okay.
It's a very sensitive issue.
It is.
A lot of the people who come in, they tell us that, maybe my spouse or my significant other or a friend or a colleague has told me. Or sometimes when I'm talking to people, I notice that they are withdrawing,
covering,
and then so they then realize something may be wrong, and then they come in. But there are other people too who they are so self-conscious. They come in with the complaint of bad breath, but you do your checks and everything, then they are fine. A lot of those times is psychological. We just have to reassure them and tell them, look, everything is fine. We don't perceive anything. You are good. And I think for most people, it calms them down. But for a number of people too, they come in and they are spouse or whoever has told them that this is the problem. And for kids, it's usually our parents who notice it. They say, "Oh, doctor, my child, she's not brushing well. We notice that the mouth, there's a scent odor in the mouth, and we want you to do something about it."
Okay. For the adults, is it possible that they started in childhood and they grew with it, or maybe along the line it just happened?
Yeah. So a lot of these things are habits. Okay.
Habits.
So maybe as when they were children, they were not, taught proper hygiene. They were not introduced to dental care, and so they grew up with these habits, and that's how come they have these issues. Yeah.
I have this message saying, are there certain foods or habits that can make bad breath worse in children? James from Medina. Talking about habits and certain foods.
So for the habits, what we've already hammered on several times, that's poor brushing or infrequent brushing. And yeah, those are the habits. And then for the foods, the notorious ones are the spices, the onions, the garlic. Those can worsen the bad breath.
Okay. We just have a minute to wrap up. Your final word to a parent listening who probably has noticed this in a child and is here to find a solution to it. And then what can you tell them?
So
and to prevent it. We didn't even talk about the preventive measures.
So we've touched on it.
On everything,
We've touched on everything. Yeah. That's the twice daily brushing, flossing, and then cleaning your tongue. So that forms part of the 3 tips I'll give. Take away if you didn't get anything from this conversation. That is to brush your teeth for 2 minutes twice daily, to floss and clean your tongue, and to have regular dental checkups.
Okay. Thank you so much, Dr. Julius.
Thank you for having me.
Thank you for coming. And then thank you to all those who listened, watched, and those who are on Facebook as well. We have a message, but I don't think we can be able to pick. As a voice note, you can pick this. I'll share with Doug for him to answer. Thank you. And then to the guys here, to Prince, to Bless, to Ezekiel, have a good working day and stay blessed. Don't forget, same time tomorrow morning, 9:30, to have a repeat broadcast on Sunny TV. Bye-bye. From infancy to adolescence, from prenatal care to safe motherhood, we discuss it all. Maternal health, vaccinations, infant nutrition, preventive care, mental, physical, and emotional wellness of both the mother and baby. We talk about what truly matters here. Tune in to Sunny 88.7 FM and also on Sunny TV every Friday morning from 9:30 a.m. to 10 a.m. Also a repeat broadcast on Saturday morning from 9:30 as we bring to you the Cradle to Crayon show. Join me and my team of doctors and health experts as we answer your questions, give you expert advice, clear all myths, and also share real solutions. Remember that informed parents raise healthy children, and healthy children build a stronger future. See you.